offering deep insights.
The 2022 Kenya Demographic and Health Survey has laid bare the country's health status. According to this survey, the Kenyan government's efforts to attain universal health coverage are facing a major hurdle, with an average of 74% of Kenyans not enrolled on any medical cover. The survey shows only 1 in 4 Kenyans has some form of health insurance, a 16% drop compared to 2019. This means that about 1 in every 5 Kenyans who previously had health insurance opted out due to reduced household incomes at the onset of the COVID-19 pandemic. 8 out of 10 Kenyans who reported having health insurance were using NHIF. However, NHIF reports a very low retention rate, with about 6 out of every 10 Kenyans not renewing their subscriptions in subsequent years. The situation is worse for those in the informal sector, where only 14% of subscriptions are renewed. Most Kenyans cite lack of affordability as the reason for low health insurance uptake, followed by lack of knowledge and awareness. This means that the majority of the country's population continues to pay for medical care out of pocket. A 2019 study shows 2.4 million Kenyans are dragged into poverty annually by high out-of-pocket expenditures on health.
The Kenya Kwanza government assures Kenyans of its commitment to strengthen the NHIF to be able to guarantee universal access to affordable health care. We also anticipate that the NHIF will increase its efficiency and scale so that it can lower the unit cost. And then it means that all of us will be covered.
President Ruto has emphasized his desire to provide Kenyans with access to high-quality healthcare, while highlighting that many citizens live in poverty due to mounting medical debt.
It is glaring that only a quarter of Kenyans have a form of health insurance, and therefore, this is one of the focus areas for improvement by my ministry as we strive to attain universal health coverage through the National Social Health Fund.
But the insurer has also faced various challenges. In its latest financial report, NHIF indicated that more than 8 million members have defaulted on their monthly contributions due to the economic crisis. A raft of reforms, according to the proposed National Health Insurance Fund regulations of 2023, seek to accelerate the attainment of universal health coverage by, among others, having employed Kenyans with higher incomes pay a flat rate of 2.7% of their monthly income to NHIF.
It is glaring that only a quarter of Kenyans have a form of health insurance, and therefore, this is one of the focus areas for improvement by my ministry as we strive to attain universal health coverage through the National Social Health Fund.
The proposals have received approval from most stakeholders, except a few who have cited the history of corruption and mismanagement of the funds at the national insurer. The claims of corruption have seen the Senate Health Committee commence investigations into the alleged loss of public money through dubious claims by benefactor health facilities across the country.
This data has provided a good background for reforms at the National Hospital Insurance Fund as we structure how best to implement universal health coverage through primary healthcare networks. Now I have the confidence to stand and say I must clean up NHIF.
In a bid to implement universal health coverage, responsibility lies in ensuring value for every individual monetary contribution. Michelle Ngele, Odhiambo, K24.